Assalamu alaikum. I'm Professor Dr. Hayder Mubarak. This is a presentation to practical aspects of the anatomical features of the infratemporal fossa, Pterygopalatine fossa, and temporomandibular joint. Starting with the temporomandibular joint, the temporomandibular joint located here on the side of the face. It is located anterior to the tragus of the auricle. The ear, the auricle of the ear, shows many folding which has many names. One of these names is called the tragus, and the temporomandibular joint is located in that position anterior to the tragus. The temporomandibular joint is a synovial joint. The articular surfaces are made by the mandibular fossa of temporal bone and the articular tubercle of temporal bone. Both these are above, forming the articular surface above, while below the articular surface forming the temporomandibular joint is the mandibular head or head of the mandible. The joint contains a disc of fibrocartilage that divides the cavity of the joint into two synovial cavities. Each of them is lined by a synovial membrane. The ligaments supporting the joints mainly include the lateral ligament of the temporomandibular joint, or it is sometimes called temporomandibular ligament. This lateral ligament extends from the articular tubercle to the neck of the mandible. It is a thickening of the fibrous capsule and it prevents backward deviation of the head of the mandible. Another ligament supporting the temporomandibular joint, which is sometimes called TM joint, is the sphenomandibular ligament that extends from the spine of the sphenoid to the mandible. The spine of the sphenoid had been described adjacent to the spinous foramen spinosum at the base of the skull. Near the foramen spinosum at the base of the skull there is a spine, small spine, which is called the spine of the sphenoid, and the sphenomandibular ligament extends from the spine of the sphenoid to the mandible. So in addition to the lateral temporomandibular ligament, the sphenomandibular ligament, the third ligament supporting the joint is the stylomandibular ligament. And I think we had described this stylomandibular ligament with the investing deep cervical fascia. We said that the investing deep cervical fascia between the angle of the mandible and mastoid process divides to enclose the parotid gland into a superficial lamina attached to the zygomatic arch and a deep lamina which is called the stylomandibular ligament. So the stylomandibular ligament is a ligament supporting the TM joint, and it represents a thickening of the deep layer of investing cervical fascia that lies below the parotid gland. Regarding the movement of the temporomandibular joint, actually the movement of the temporomandibular joint is produced by muscles, four muscles, which are called muscles of mastication. One of these muscles is temporalis muscle that originated from the temporal fossa of the skull and inserted into the coronoid process of the mandible. The other muscle of mastication, the second muscle of mastication, is the masseter muscle, which is a quadrilateral muscle attached to the side of the ramus of the mandible and inserted into the zygomatic bone. The third and fourth muscles of mastication, in addition to temporalis and masseter, could be seen when removing part of the mandible with masseter muscle and temporalis muscle. Because these muscles, the other two muscles of mastication, are located inside the infratemporal fossa. They are attached to the pterygoid plate. You know that the base of the skull shows a lateral pterygoid plate and a medial pterygoid plate. And these muscles are called pterygoid muscles because they are attached to the lateral and medial pterygoid plate. One of them is called lateral pterygoid muscle and the other is called medial pterygoid muscle. You can see that both of these muscles are originating by two heads. The lateral pterygoid muscle is inserted into the neck of the mandible, while the medial pterygoid muscle is attached to the medial aspect of the angle of the mandible. Actually, movement of the temporomandibular joint are either movement anteriorly, which is called protraction, when the mandible is pushed anteriorly, or movement of the mandible at the TM joint posteriorly, which is called retraction. So there is a protraction anteriorly and retraction posteriorly. Or we may move the mandible up by closing the mouth when the lower teeth comes in contact with the upper teeth. This is an elevation, or depression, in which the mandible gets down to open the mouth when the upper teeth and lower teeth are separated to open the mouth. So movement of the temporomandibular joint is an anterior protraction, posterior retraction, upward elevation to close the mouth, and downward depression to open the mouth. The arrows here shows you the movement very clearly. Actually, we said that the joint cavity of the temporomandibular joint, we had just described a fact that the joint cavity is divided by a disc into two spaces, an upper space and a lower space. And actually, the upper space shows the movement of protraction and retraction, while the lower space shows movement of elevation and depression, as following. Regarding first protraction, which is anterior protraction. Anterior protraction is produced by lateral pterygoid and medial pterygoid muscle, as the arrow indicates. While posterior movement or posterior retraction is action produced by the temporalis muscle. Depression is produced by muscles below the mandible that are extending between the mandible and the hyoid bone, including digastric muscle, mylohyoid muscle, and deep to mylohyoid geniohyoid. While elevation, the upward movement, is a function produced by masseter, produced by temporalis, and also produced by medial pterygoid, as the arrows indicates. Blood supply to the TM joint, to the temporomandibular joint, is from the adjacent arteries. You remember that the external carotid artery divides inside the parotid substance, inside the substance of parotid gland, behind the neck of the mandible. Here, the external carotid terminates to give maxillary artery and superficial temporal artery. The superficial temporal artery ascends up to the temporal fossa, while the maxillary artery passes to the infratemporal fossa. The superficial temporal artery and maxillary artery are branches of the external carotid that supply the TM joint, in addition to the ascending pharyngeal artery and auricular branches. Nerve supply is via the auriculotemporal nerve and masseteric nerve. Regarding clinical application, the TM joint sometimes is dislocated when the head of the mandible gets out of the mandibular fossa. Such dislocation is usually anterior when the head of the mandible gets out and moves out of the mandibular fossa anteriorly. It occurs when we bite a big piece of food, or when we are yawing, or when there is a blow on the side of the face. Actually, in this dislocation, the patient will always keep his mouth open. He cannot close his mouth because it is very painful, and in that condition there will be a possibility of damage to the facial nerve, which is the seventh cranial nerve, and the damage to the auriculotemporal branch of mandibular nerve. Actually, dislocation of the TM joint is not so difficult. It could be reduced under sedation very easily by the expert hand. Regarding the infratemporal fossa, we had said that the infratemporal fossa, in order to be examined, we must remove masseter muscle and remove the ramus of the mandible to enter the infratemporal fossa, as in this figure shown. We had shown you that in this figure, if you remove masseter, removing the ramus of the mandible, you will see medial and lateral pterygoid muscles. These muscles attached to the lateral pterygoid and medial pterygoid plate, and they are content of the infratemporal fossa. Therefore, this infratemporal fossa communicates with the temporal fossa containing temporalis muscle by the space deep to the zygomatic arch. If you want to pass from the temporal fossa to the infratemporal fossa, you have to pass deep to the zygomatic arch to reach the infratemporal fossa. The infratemporal fossa contains the maxillary artery, which is a terminal branch of the external carotid artery with its branches, and also it contains the mandibular nerve, which is a branch from the trigeminal nerve, and they will be discussed soon. But Now we will say that the infratemporal fossa not only communicate with the temporal fossa via the space deep to the zygomatic arch, but also the infratemporal fossa communicates with the middle cranial fossa via foramen ovale and foramen spinosum at the base of the skull. And also the infratemporal fossa communicates with the pterygopalatine fossa via the pterygomaxillary fissure. Actually, therefore, the boundaries of the infratemporal fossa are the following. Laterally, we have masseter, ramus of the mandible, and you know that the ramus of the mandible shows two processes. This process is called condyloid process, and that is called coronoid process. So, lateral boundary of the infratemporal fossa include masseter muscle, ramus of the mandible with condyloid and coronoid process. You know that the condyloid process shows the head and neck of the mandible, and in between the condyloid and coronoid process, this notch is called mandibular notch. So again, the boundaries of the infratemporal fossa laterally are masseter muscle, ramus of the mandible, condyloid and coronoid process of the mandible. We must remove this lateral boundary in order to pass to the inside of the temporal fossa, and therefore if we pass to the inside of the infratemporal fossa, we may see the medial wall of the infratemporal fossa represented by the lateral pterygoid plate, tensor villi palatini and tensor levator villi palatini. These are two muscles behind the lateral pterygoid plates representing the medial boundary. So the medial boundary include lateral pterygoid plate, tensor villi palatini, levator villi palatini, and the upper constrictor of the pharynx, a muscle in the pharynx which are called superior constrictor muscle. The pharynx is surrounded by three constrictor muscles: superior constrictor, middle constrictor, and inferior constrictor. This constrictor constricts the food to push it down into the esophagus, from the pharynx to the esophagus. And the superior constrictors muscle share information of the medial boundary of the infratemporal fossa. Therefore, the medial boundary include lateral pterygoid plate, tensor villi palatini, levator villi palatini, and superior constrictor muscle. Anteriorly, the boundaries of the infratemporal fossa is the maxilla bone, while posteriorly is the carotid sheath. The roof, which is denoted here by the arrow, the roof is the greater wing of sphenoid, while the floor is the medial pterygoid muscle. You can see that medial pterygoid muscle is the content of the infratemporal fossa and the floor of it. Lateral pterygoid and medial pterygoid muscles are a content, but medial pterygoid, in addition to being content, it is the floor of the infratemporal fossa. Regarding contents of the infratemporal fossa, as we said before a while, mainly contain the muscles of mastication, which are this muscle, which is lateral pterygoid muscle, and this muscle, which is medial pterygoid muscle. The medial pterygoid forms the floor of the infratemporal fossa and also a content. In addition to lateral pterygoid and medial pterygoid muscle, temporalis is also a content of the infratemporal fossa. Don't forget that temporalis muscle inserted into the coronoid process of the mandible. Temporalis muscle originated from the temporal fossa. The tendon of temporalis muscle pass deep to the zygomatic arch, and the tendon of temporalis muscle, after passing deep to the zygomatic arch, is attached to the coronoid process of the mandible. So, content of the infratemporal fossa includes first muscles, which are medial pterygoid, lateral pterygoid, masseter muscle, and part of temporalis muscle. In addition to the muscles, the infratemporal fossa contains also nerves and vessels. Actually, to describe nerves and vessels as a content of the infratemporal fossa, the lateral pterygoid muscle is considered as a key muscle in the infratemporal fossa. So there are some structures above lateral pterygoid, other structures below lateral pterygoid, and there is structures in between the two heads of lateral pterygoid. You can see that here very clearly. The deep temporal branch of mandibular nerve is projecting above lateral pterygoid. The inferior alveolar and mandibular branches of mandibular nerve passing below lateral pterygoid muscle, and buccal nerve passing in between the two heads of lateral pterygoid. Also below lateral pterygoid, the maxillary artery. So below lateral pterygoid maxillary artery, inferior alveolar nerve and lingual nerve. In between the two heads is the buccal nerve, and above lateral pterygoid is deep temporal nerve. Actually, the mandibular nerve, all its branches are a content of the infratemporal fossa. The mandibular nerve is a branch of the trigeminal nerve. It is originating inside the cranial cavity in the middle cranial fossa, but this mandibular nerve reached the infratemporal fossa after passing through the foramen ovale. When the mandibular nerve reached the infratemporal fossa after passing through the foramen ovale, it will give many motor and sensory branches, because the mandibular nerve is a mixed nerve, motor and sensory. Here I'm trying to represent the motor branches with a green arrow. It includes deep temporal nerve supplying temporalis muscle, nerve to masseter muscle, nerve to mylohyoid, nerve to lateral pterygoid and medial pterygoid muscles. So mandibular nerve actually supplies muscles of mastication in addition to mylohyoid muscle. And in addition to these motor branches of the mandibular nerve, the red arrow shows sensory branches of the mandibular nerve, which are auriculotemporal nerve supplying the side of the face and the scalp, and also another sensory branch is the inferior alveolar nerve, which had been just shown below lateral pterygoid. This nerve, the inferior alveolar nerve, from its name, it supplies the lower teeth, the alveoli of the lower teeth of the mandible. Inferior alveolar nerve pass into the mandibular foramen, which is on the side, on the medial side of the body of the mandible, and run inside the body of the mandible to supply the lower teeth, and it usually anesthetized in operation or to the lower teeth. Another sensory branch from the mandibular nerve, in addition to the auriculotemporal inferior alveolar, is the lingual nerve. The lingual nerve, as I said before a while, also passes below lateral pterygoid, the key muscle, and from its nerve lingual, it supplies the anterior two-thirds of the tongue by general sensation. Also, buccal nerve, which is a sensory branch, another sensory branch from the mandibular nerve that we had just seen in between the two heads of the lateral pterygoid. So these are the motor and sensory branches of mandibular nerve represented by the green and red arrow respectively. Other nerves that are content of the infratemporal fossa is a branch from the facial nerve, which is called chorda tympani. This branch of facial nerve connected with the lingual nerve and reaching the anterior two-thirds of the tongue. So the lingual nerve will give general sensation to the anterior two-thirds of the tongue, while the chorda tympani accompany the lingual nerve will give taste sensation for the anterior two-thirds of the tongue, and you will study that soon with the anatomy of the oral cavity. The mandibular nerve is associated with the otic ganglia, that is one of the four parasympathetic ganglia of the head and neck. And I think we had discussed these four parasympathetic ganglia, peripheral parasympathetic ganglia of the head and neck, with the presentation of the parotid gland, and we had described the connections, parasympathetic connection of the otic ganglia that is located near the mandibular nerve, near the foramen ovale, and it gives its parasympathetic supply to the parotid gland with the auriculotemporal branch of mandibular nerve, which is a sensory nerve. In addition to muscles as a content of the infratemporal fossa, nerves that had just been described, the infratemporal fossa contains also vessels, which are mainly the maxillary artery and the pterygoid venous plexus. The maxillary artery had been described more than one time. It is one of the terminal branches of the external carotid artery. The external carotid artery inside the substance of parotid gland terminates into superficial and maxillary arteries, which are terminal branches of the external carotid artery. So this maxillary artery passes in the infratemporal fossa, as you can see. The course of the maxillary artery in the infratemporal fossa could be described to be divided into three parts. From the origin of the maxillary artery till the lower border of lateral pterygoid muscle, this part of the maxillary artery is called first part of maxillary artery. The second part of the maxillary artery is from the lower border of lateral pterygoid muscle till the pterygomaxillary fissure. This part, the second part of the maxillary artery, is either superficial to lateral pterygoid muscle or it may be deep to it. And the third part of the maxillary artery is the part which is passing through the pterygomaxillary fissure, and so this third part of maxillary artery is inside the pterygopalatine fossa, and it will be described with the pterygopalatine fossa. You can see that this figure shows clearly the relation to lateral pterygoid muscle as a key muscle in the infratemporal fossa. So there are structures at the upper border of lateral pterygoid muscle, which are nerve to masseter, supplying masseter muscle, deep temporal nerve, supplying temporalis muscle. Of course, these are motor branches from the mandibular nerve. And also, at the lower border of the lateral pterygoid muscle, we have middle meningeal artery, branch of the maxillary artery, inferior alveolar nerve, which is sensory to the lower teeth, and lingual nerve, which is passing to the tongue, while in between the two heads is buccal nerve, which is sensory to the cheek, to the skin of the cheek. Regarding the branches of the maxillary artery, these branches should be also described in regard to the parts of the maxillary artery. So the first part of maxillary artery, which is between the origin of maxillary artery to the lower border of lateral pterygoid, this first part gives middle meningeal artery that passes through the foramen spinosum into the cranial cavity, supplying the middle cranial fossa. And also the first part of maxillary artery gives inferior alveolar artery that runs with the inferior alveolar nerve and the mandibular fossa, supply the lower teeth. And branches from the second part of the maxillary artery are muscular branches to the muscle. Branches from the third part are branches in the pterygopalatine fossa and will be discussed with the pterygopalatine fossa. We have to say that the maxillary artery is also associated with pterygoid venous plexus, and actually the pterygoid venous plexus is located inside the substance of lateral pterygoid muscle. You will not see a real pterygoid plexus because it is inside the substance of lateral pterygoid muscle. Regarding clinical anatomy, sometimes fracture to the pterion, which is H-shaped suture on the side of the skull. This region, the pterion, had been described with the skull, is a weak region in the skull. The pterion is a H-shaped suture meeting between parietal frontal bone, temporal bone, and the greater wing of sphenoid. If the blow here may produce a fracture to the pterion, this fracture will result in accumulation of blood in the extradural space, which is called extradural hematoma, that will increase the pressure inside the cranial cavity and may lead to herniation of the brain and ischemia. And so we may produce a drill hole or a bar hole into the bone to evacuate this extradural hematoma by drilling the calvaria to get into the hematoma and draining the blood. Regarding the anatomy of the pterygopalatine fossa, you know that the infratemporal fossa is connected with the pterygopalatine fossa by the pterygomaxillary fissure. We had described that with the infratemporal fossa. The pterygopalatine fossa is represented as an inverted conical space, which is four-sided conical space. It has medial wall, lateral wall, anterior and posterior wall, so it is four-sided inverted cone or inverted pyramid with the apex below and the base above. And so this four-sided inverted cone or conical space, the pterygopalatine fossa, is limited anteriorly, as you can see by the star. This is the fossa. It is limited anteriorly by the body of maxilla. Of course, this body of maxilla contains maxillary air sinus. So the wall anteriorly of the pterygopalatine fossa is the body of maxilla containing maxillary air sinus, while the posterior wall of the pterygopalatine fossa is formed by the pterygoid process that shows the medial and lateral pterygoid plate. You know, this region is called pterygoid process. It divides into medial and lateral pterygoid plate. So the anterior wall of the pterygopalatine fossa is formed as the star indicate by the body of maxilla containing maxillary air sinus, while the posterior wall is formed by the pterygoid process containing medial and lateral pterygoid plate. Superiorly, the pterygopalatine fossa is formed by this fissure, which is called infraorbital fissure, this fissure connects the pterygopalatine fossa with the orbit anteriorly. Inferiorly, the pterygopalatine fossa, here the apex of course of it, the pterygopalatine fossa is formed by the pyramidal process of palatine bone. Medially, as the arrow indicates, the depth of this fossa is formed by the vertical plate of palatine bone, which is separating the pterygopalatine fossa from the nasal cavity. And you can see that the tip of the yellow arrow indicates the sphenopalatine foramen connecting the pterygopalatine fossa with the nasal cavity medially. And of course, laterally, the lateral boundary of the pterygopalatine fossa is the pterygomaxillary fissure connecting this fossa with the infratemporal fossa. Regarding the medial wall, which is, as I said, vertical plate or perpendicular plate of palatine bone containing this foramen, which is a sphenopalatine foramen that connect this fossa with the nasal cavity medially, I want you to look to this figure. This is a sagittal section into the nose. This is the nasal cavity. This is the hard palate, and here is the oral cavity. You can see that as we had described in the session of the skull, the hard palate anteriorly is formed by maxilla, by the palatine processes of maxilla, while the hard palate posteriorly is formed by the horizontal plate of palatine bone. And you can see that this horizontal plate of palatine bone continues up as the vertical plate of palatine bone, which forms part of the lateral wall of the nasal cavity. And this vertical plate of palatine bone shows here the sphenopalatine foramen. So the sphenopalatine foramen here present in the lateral wall of the nasal cavity are seen here forming the medial wall of the pterygopalatine fossa. Of course, the pterygopalatine fossa contain maxillary nerve and the parasympathetic ganglia, which is associated with the maxillary nerve, that is called pterygopalatine ganglia, and the third part of maxillary artery. And I want you to remember what is the pterygopalatine ganglia by going to the previous slide. We had described 4 parasympathetic peripheral ganglia in the head and neck, and this is the pterygopalatine ganglia, which is one of them that is lie in the pterygopalatine fossa close to the maxillary nerve. So, content of the fossa are the maxillary nerve with its associating pterygopalatine ganglia and the maxillary artery. Starting with description of the maxillary nerve. Of course, the maxillary nerve is one of the 3 branches of the trigeminal nerve. The trigeminal nerve gives ophthalmic branch, maxillary branch, and mandibular branch. We had studied mandibular branch in the infratemporal fossa because this mandibular branch passes through foramen ovale from the middle cranial fossa to the infratemporal fossa. Now we will describe the maxillary branch of trigeminal nerve. Also, the maxillary branch of trigeminal nerve begins in the middle cranial cavity. It passes through foramen rotundum of the skull to enter the pterygopalatine fossa. And after leaving the pterygopalatine fossa, the maxillary nerve passes through the inferior orbital fissure that forms the upper boundary of the fossa to enter the orbit. And then inside the orbit, the maxillary nerve exits out the infraorbital canal to supply the skin of the face below the orbit. This maxillary nerve, as we said, is closely related and connected to the pterygopalatine ganglia, which is here described as sphenopalatine ganglia. This is the other name of the pterygopalatine ganglia. Branches of the maxillary nerve are pharyngeal branches to the pharynx, lesser palatine and the greater palatine branches that passes through the foramen in the hard palate to the roof of the mouth. Here in the hard palate we have lesser palatine foramen, and the greater palatine foramen have been discussed with the skull, and the lesser palatine nerve and the greater palatine nerve pass through these foramen. So branches of the maxillary nerve are pharyngeal branches to the pharynx, lesser and greater palatine nerves, superior alveolar nerves supplying the upper teeth, nasopalatine nerve that passes through the nasopalatine foramen, which is in the vertical plate of palatine bone, and infraorbital nerve that supply the skin of the face below the orbit, and zygomatic nerve that supply the skin of the face over the zygomatic bone. The pterygopalatine ganglia, as I said, is one of the peripheral parasympathetic ganglia of the head and neck. There are 4 ganglia. It receives preganglionic fibers that originates from from the salivatory nuclei of the medulla. The axon of the inferior salivatory nuclei in the medulla pass with the facial nerve, and this axon then leave the facial nerve as the greater petrosal branch of facial nerve. This greater petrosal nerve branch of facial nerve that carry axons of the salivatory nucleus of the medulla, which are parasympathetic axons, connected with the neurons in the ganglia. And axons of neurons of the ganglia supply the lacrimal gland, the nasal cavity, glands in the nasopharynx and palate via the branches of the maxillary nerve. Regarding the maxillary artery, we had described the maxillary artery as a terminal branch of the external carotid artery behind the neck of the mandible inside the substance of parotid. You can see this figure colors the maxillary artery in green, then in yellow, then in blue, because it is formed of 3 parts. The first part of maxillary artery is from its origin to the lower border of lateral pterygoid. The second part is either superficial to lateral pterygoid or deep to lateral pterygoid, and the third part, which is the blue one here, is in the pterygopalatine fossa. So now we will describe branches of the maxillary artery in the pterygopalatine fossa. Here the maxillary artery gives sphenopalatine branch, or called nasopalatine branch, that passes through the sphenopalatine or nasopalatine foramen, which is in the vertical plate of palatine bone and reaching the nose, supply the nose. Also, the maxillary artery gives infraorbital branch that exit with the infraorbital nerve, branch of maxillary nerve to supply the skin of the face, and also superior alveolar branches supplying the upper teeth, and descending palatine branches to the hard palate. The sphenopalatine that passes through the medial wall of the pterygopalatine fossa through the sphenopalatine foramen and vertical plate of palatine bone is very important in cases of bleeding from the nose, which is called epistaxis. Sometimes it is called the artery of epistaxis, because recurrent chronic bleeding from the nose must be treated by surgery and ligation of the sphenopalatine artery through an operation done through the maxilla, then maxillary air sinus, to reach the pterygopalatine fossa and ligating the sphenopalatine artery. Finally, this subject is concerned with connections of the pterygopalatine fossa. We had described connections of the infratemporal fossa before a while, but now we will describe connections of the pterygopalatine fossa. The pterygopalatine fossa connected with the nasal cavity through sphenopalatine or nasopalatine foramen, which is foramen in the vertical plate of palatine bone. Also, the pterygopalatine fossa is connected with the pharynx via the pharyngeal canal, specifically the nasal part of the pharynx. Also, the pterygopalatine fossa connected with the middle cranial fossa via the foramen rotundum. We know that the maxillary nerve passes through foramen rotundum from the middle cranial fossa to pterygopalatine fossa. Also, the pterygopalatine fossa connected with the base of the skull by the pterygoid canal, and with the infratemporal fossa by pterygomaxillary fissure, and with the oral cavity via the greater and lesser palatine foramen. which is here denoted as the palatine canals. Actually, it is also connected with the orbit via the inferior orbital fissure, which is the base of the four-sided conical pterygopalatine fossa. Actually, it is easy to remember the connections of pterygopalatine fossa as this figure shows, but it's difficult, at least for me, I'm a professor in anatomy, to enumerate branches or content that passes through each of these communications. It's very difficult to me to remember each of these connections transmitting what structures as it is shown here. So this is the most important part regarding practical aspects of the topics of infratemporal fossa, pterygopalatine fossa, and the TM joint, which is temporomandibular joint. I hope I'm helping, because these are 3 lectures and I'm summarizing it in one. Thank you very much.